Hello, everyone. Hello, and welcome to this auspicious event. Um, this is Chijoke Otiba here, the founder of Healthy Wealthy Moms Club, and I have really amazing guests, really amazing guests tonight. It's a very important topic that we'll be discussing. Very important topic. I know a lot of people have had questions over time. And the tricky thing about the internet is information overload. So there's a whole lot going on, and there's a whole lot of information flying around over people's heads. It's difficult to articulate all of these things and find out what's actually applicable, and what is evidence based, because it's not just about getting information. You have to know what is safe, what is ethical, what is right, what is accurate, that you can explore options without risks, with minimal risks. So tonight, I keep saying tonight as if it's night, but yes, today we are going to be having our
Chichuke, I think we lost your sound.
okay. Am I back?
Yes, you're back.
Okay. So, oh, thank God. I minimized my screen. I minimized my screen to go and get the bio, and then it shut off my sound. But I'm back here. I've posted it here. So, like I was saying, um, the the we're going to be having an amazing host. I mean, an amazing guest with us to discuss these things. I was talking earlier about information overload and the fact that there's just so much information out there. It's difficult to know which one is right, which one is safe, which one is ethical, which one is accurate. So we will be having this opportunity, this wonderful opportunity to ask any questions in our hearts about fertility, about infertility, about anything at all concerning this topic. And we'll be having with us a clinical embryologist with subspecialty in pre-implantation genetics, over 10 years of experience, a master's in prenatal genetics, fetal medicine, and clinical embryology from University College London and University of Leeds. So biostatistician for AFRH registry, looking at fertility trends in Nigeria, role head embryologist and practice director. Ladies, and I don't know if there's any gentleman watching us,
Oh,
but
you're a gentleman.
ladies, he said,
You're a gentleman.
oh, that's true. That's true. Ladies and gentlemen and future gentlemen that will join very soon. You're welcome to this session. Behold Denma Sekibo. I hope I got that correctly.
Yes, you did. You tried. You did a good job.
Thank you very much. Thank you very much. You have the floor.
Okay. Hi. Thank you so much for that lovely introduction. And before we get started, I want to say thank you to the Healthy and Wealthy Moms Club for the opportunity to come and speak to. We in setting this webinar, we sent a couple of questions that we know are most common that we get, and you as a community, you asked us to speak on the common misconceptions about secondary infertility. So that's what we're going to be talking about today. The session today, we want it to be as interactive as possible. So before we get started, please feel free to send a thumbs up so that I know that you're with me. As I'm speaking, feel free to drop your questions in the chat box or in the chat option provided. and or in the WhatsApp group, you're not able to put it on the chat, and we will attend to it at the end of the presentation. So please note it down, because sometimes once you're hearing things going along, you might forget. So please send in your questions. So let's get started. So we're going to be talking again, like I said before, about the common misconceptions about secondary infertility. Just like Chijioke kindly, my name is Deima Sekibo. I'm a clinical embryologist. I self-specialize in pre-implantation genetics, and I'm also the practice director at Orchid Fertility Clinic here in Abuja. So let's dive right into it. What is secondary infertility? And why is trying the second time round not straightforward? So basically, the basic definition, the simplest definition is the inability to conceive a child or a subsequent child after a previous successful pregnancy. And this successful pregnancy would have been attained without any kind of assisted reproduction, any kind of medical intervention. So I mean in terms of no ovulation induction, no IUI, and definitely no IVF. So that's what we term as secondary infertility. Just a breakdown of what we're going to be talking about today. Just as the title says, we're going to be talking about the common misconceptions. We're going to discuss, the effects of these misconceptions. Then we'll talk about the biology, what the reality is about the causes of secondary infertility, and finally, how people who are experiencing secondary infertility can get support. So let's go right into it. The first misconception: if you had a baby before, fertility isn't a problem. Now, one of the key things about secondary infertility is previous pregnancy doesn't necessarily mean that there's current fertility. The thing about fertility, like everything in life, it changes over time. Your ability to get pregnant and how quickly that happens changes over time. The second conception is that secondary infertility is rare. It's very, very underreported, because especially in our community where they say child, at least you should be grateful. So a lot of the time, people wait a long time before they come in and, have a conversation that, okay, we're actually having a problem having another baby. In places that we have a lot more statistics, so like in the UK and the US, they have recorded that secondary fertility is as high as 5 to 11% of couples experience secondary infertility. Next misconception, that it is stress induced and affected by mindset. One thing I will say, that stress is definitely can affect your cycle, but it's rarely ever the sole cause of infertility. So what it can do is it can delay ovulation. I know there are women on here that sometimes that you're stressed and you realize that actually your period is delayed or it comes earlier. So yes, there is some kind of effect of stress on your cycle and on ovulation, but it is rarely ever, because it can be, but it is rarely ever the sole cause of the secondary infertility. What is typically the cause is the biology. There's typically something wrong with the hormones, with the systems that are in place, and with the structures that are in place. So moving on to the next misconception, that age only matters the first time around. Now, I know as information is being passed, as people are getting more information, being exposed to the internet, one of the key things that everybody's very well aware of is after 35, your fertility drops. And that is what they say. Young ladies, they hand it to us, we get pregnant, don't wait too long, make sure you try and get pregnant early and all of that. So the focus often is that first time you try, you won't wait before you turn 35, right? But what I'm going to say is that every subsequent time, your age matters in terms of your egg quality. Now, egg quality declines as you age, right? And that is because we are born with all the eggs that we're going to have as women, right? And these eggs have to stay in a very sensitive state for a very long period, right? And it's tightly controlled by certain systems, inbuilt systems in the ovary, right? But as we age, obviously these systems also age. So therefore, the eggs become more and more sensitive to any form of environmental changes, anything at all, and that causes the quality to begin to decline. It's just a natural phenomenon of aging, right? So that affects the quality. So if you get pregnant, the first pregnancy is at 28, then you're saying, okay, I want to pursue my career, which is, there's nothing wrong with it, it's fantastic, right? And the next time you want to get pregnant is about 33. Your fertility at 28 is definitely different from what your fertility picture will be at 33. So that's what, it matters every single time you're trying. It's not just the women, it affects men as well. Age is an important factor in men. In sperm quality, similar to women, not necessarily, they're not born with all the sperm they're ever going to have. Men produce sperm every 3 months, right? A new batch of sperm is produced every 3 months. But in terms of the systems that produce this sperm, the structures that produce this sperm, they also age. So by that, the quality of sperm also decreases by age, right? And there's a sharp decline after 40. And this is shown by, increased miscarriages when the male partner is above 40, and reduced rates of pregnancy in those populations. So moving on to the fifth misconception, my cycles are regular, so I'm fine. Now, when cycles are regular, it is a good indication that the hormones are balanced and things are working as they ought to be. One thing that I will mention is that just because you're having a period doesn't necessarily mean that you're ovulating, right? Although if you have regular, it is a promising sign that things are going as they ought to be. Now, if you're ovulating, we also have to consider factors like the egg quality. Is the egg that is being ovulated of good quality enough to elicit a successful pregnancy? Is the reserve high enough? So are you able to recruit a good number of eggs every cycle, right? And is your pathway, so the fallopian tubes, are they open? Is it open so the egg and the sperm can meet and the fertilized embryo move down into the uterus and then fertilize? So it is fertility is an interplay of different factors. So you can't just look at your cycle being as the only indication that okay, everything is fine. The sixth misconception, factor doesn't matter if he has fathered a child before. Again, just like I said in the women, fertility changes over time, quality changes over time, right? Factors that can affect this, besides age itself, changes in weight, illnesses like diabetes, stress, especially in this our climate where Tinubu is doing what he can do, and having high rates of high BP, and the medications that they even take to battle these things can affect sperm quality. So even if earlier on you were able to father a child, doesn't necessarily mean that that's going to happen as easily as it did historically. So the seventh and final misconception before we really get into the nitty gritty is if it hasn't happened yet, then it probably wouldn't, right? One of the things, secondary infertility is one of the bigger reasons that we have people come into the fertility clinic, right? And is probably also one of the, well, if I say one of the ones that we don't like to see, but it definitely has better outcomes, right? Because since you've had a child before, there's an indication that, look, this can happen again. So that's a positive prognostic factor, right? So if we're able to do proper assessment, you come in on time, and we're able to treat the cause of the infertility, it's more likely that we have a good outcome. So if it hasn't happened yet, it probably wouldn't. That is definitely a fallacy. So let's talk about the real cost implications of these misconceptions. Now, delayed diagnosis, right? If you think, okay, age doesn't really matter, you don't come in, it means that we're not able to pick up on something as quickly as we should, right? And it also means that we miss treatment windows. So once there's an issue, right, and we're able to address it on time, it will mean that it is likely that the level of intervention that we will give is less. So if I give an example, if we have a situation where the woman is not ovulating as she should be ovulating, right? Or there's like a thyroid issue or something like that, and we pick it up on time, right? It's more likely that what we're doing is just inducing ovulation, treating the thyroid issue or inducing ovulation, and then she can go on and have timed intercourse and possibly have a successful outcome. Now, if you continue to wait, let's say this happens at the age of 30, if you continue to wait, you delay diagnosis, that thyroid issue is still there. But as you're waiting, the egg quality is also reducing. So as you wait, the next thing that you might need is an IUI, then subsequently an IVF, and then if you wait even longer, you might now need donor eggs to be able to conceive and carry a child to term, right? So that's what I mean by mistreatment windows. Another thing that is a factor is emotional strain. Um, in the TTC community in general, we have a lot of it's a very emotive time for people, right? So, and I feel, especially in secondary infertility, sometimes the strain is minimized or is not taken seriously simply because you have a child already. Unlike women that have or couples that have primary infertility, they don't even have any child. So it seems like theirs is more important. But even in secondary infertility, the need for a second child, a third child is still valid, right? And it still causes emotional strain within the individuals and also marital strain. So this is the cost, right? That you can bear or people bear during secondary infertility. Now let's look at the causes. Let's look at the science. Now, secondary infertility can affect one or both of the partners. In women, like I've discussed, as I've mentioned, kind of went into a little bit, I've gone into a little bit. The quality and the quantity of eggs can be a factor. Scarring and blockages. Now, this is, scarring and blockages, they're more common, especially if you've had a child and you've had a child through a cesarean section, for example, or if you've had any kind of abdominal surgery, pelvic surgery, I mean, right? So that's taking out a fibroid, anything, and then in men, any kind of even an appendectomy, anything at all in the pelvic region can lead to scarring, and this scar, depending on the severity, can lead to blockages. Scarring can be in the uterus, right? And it can cause something called Asherman syndrome, right? Where, there's scarring in the uterus and that um, makes it more difficult for the embryo to attach to the uterus and for a baby to then, develop and be born, right? Another thing that can happen, another factor or cause of secondary fertility is polycystic ovary syndrome. It's another one that is very, very popular now in terms of awareness, not necessarily that it's on the rise, more like people know more about it, people are speaking up about it, which is very good. But in this subset of women, they have things like irregular periods, cycles where they don't ovulate called anovulatory cycles. And because of that, the time to conception is typically longer for them, right? Obviously, polycystic ovary syndrome is a spectrum. So there are some people that still ovulate. There are some people that don't ovulate at all, don't see periods at all. So it's a spectrum. So depending on where they are in the spectrum, it can, lead to secondary infertility. Endometriosis. Now, this is where portions of cells that are supposed to be in the lining of the uterus grow in other parts of of the body. It can be on the ovaries, it can be anywhere really, and this definitely affects outcome. Definitely affects your fertility. Thyroid disorders. Now, the thyroid is one of the structures in the brain, one of the structures that controls the system, right? It's the one of the hubs for the hormones, right, that are produced that allow ovulation and regulation of the system, right? So if this thyroid is overactive or if it's underactive, it can definitely cause secondary infertility. Another thing is weight gain, especially in women. When we gain weight, it can affect our ovulation, right? And as we know, we need ovulation to get pregnant. So that's one of the things that it can affect. It can affect ovulation, it can affect our hormones, right? I'll leave lifestyle changes because this kind of cuts across both men and women. So I'll move on to the men. Men, the causes of secondary infertility, when it's a male factor thing, is typically reduced testosterone levels. And this can be caused by diabetes, by thyroid issues, it can be caused by cancer. It can also be caused by genital infections like gonorrhea, chlamydia. All of these things can cause reduced testosterone levels. Sperm quality, like I spoken about earlier on in the presentation, that it declines with age. And also, it is affected by environmental factors as well. Testicular varicocele. Now, a varicocele is when the vessels in the testis become dilated, so they enlarge, right? And when they enlarge, it increases the temperature in the testis. The temperature in the testis is something that is supposed to be controlled, right? That is why it hangs lower than the body. It is the temperature in the testis is lower, like it's a lower temperature than what's in the body. It's lower than 37. So when you have these blood vessels dilate in the testis, what you're having is body temperature blood passing through that area, heating up the testis. And that means that sperm production is now impaired. So in men that have testicular varicocele, we typically see an impairment of their sperm quality. Another thing that we do have, another thing to consider is prostate enlargement or removal. Now, once the prostate is enlarged, again, it lowers the sperm count. Another thing that it can do is cause abnormal ejaculation. One of the functions of the prostate is to produce fluid, produce proteins and nutrients that nourish the sperm for its journey to going on its way to fertilize the egg. So if this prostate is not functioning or if it has been removed, that would definitely affect. Now, lifestyle factors cutting across both men and women, smoking, drinking, not eating healthily, things like that can affect fertility. Another thing that I think people don't talk about enough is actually that first child, right? Having inadequate intercourse, not enough time together, emotional stress, all of that, can play a part in secondary fertility. Now, typically, one thing I didn't put on the slides, typically with secondary fertility, it's typically not just one thing. It's typically a combination of factors that lead to this or contribute to the secondary infertility. Now, when do you seek help? If you're under 35, 12 months, from 12 months to a year, you should probably speak to somebody about the difficulties that you're experiencing. If you're under 35, after 6 months, so if you're over 35, my bad, after 6 months is a good time to come and ask for help and see what's going on. Now, this 1 year and 6 months only applies if you do not have the following red flags. So if you've got irregular or very painful periods, if you've had any kind of pelvic surgery, that includes cesarean sections, fibroid surgery, any kind of pelvic surgery like an appendectomy, anything like that. So appendectomy is removal of the appendix, right? That's either in the male or the female. So any pelvic surgery, right? If there's any history of recurrent miscarriages, or if there's an ectopic pregnancy. In ectopic pregnancy, typically the treatment, if it's surgical, requires removing of one fallopian tube, of the affected fallopian tube. So if you've only got one fallopian tube, it makes sense for you to present sooner if you're having issues conceiving the next child. If there's a history of fibroids, and finally, if the male partner has any medical or fertility risk factors that I stated before. So medical risk factors would be things like diabetes, high blood pressure. Fertility risk factors would be previously, as a couple, you found out that you guys have some issues with the sperm count, motility, or the concentration, so total sperm number. So how do we as fertility specialists, healthcare professionals support women with secondary fertility? The very first thing is an individualized review. So you'd have a consultation. They'll typically do a transvaginal ultrasound. We would take some bloods from the woman and her partner, and her partner would also do a semen analysis. This is just the absolute baseline of what we do. Now, based on that, further tests and actions may be required. So that's when the clear plan comes into mind. So, for example, in women that have fibroids, right, a plan will be made depending on the size, position. Is it affecting the endometrium? Where is it? How big is it? Then we can say, okay, you need a myomectomy. What's the wait time for the myomectomy in terms of recovery time? So all of that then goes into the plan, right? And then, we proceed with the stepwise care. And what's really, really important is to have counseling. Like I said before, infertility, whether primary or secondary, is a highly emotional and highly sensitive time in the people that are experiencing it. So counseling and support, professional counseling and support is extremely important during this time. So, just in conclusion, I'm just going to say that secondary infertility is just biology responding to time and change and what we experience in the natural course of time. What is most important is early assessment, because it provides clarity and enables the healthcare provider to give you effective care. Thank you so very much. Hello? I'm going to go ahead and open up for questions. I don't know if anybody can still hear me. Can you hear me?
Loud and clear. I can hear you.
If you can hear me, please drop a thumbs up.
I can hear you. Can you hear us? Thank you so much for that.
Yes, we can hear you I can hear you very clearly.
Yeah.
Okay, so I'll go ahead and take some questions.
I would start from the live chats because some people dropped their questions before pre-registration. So we also had questions from the pre-registered attendees. So weight gain, does weight also cause infertility issues in men as part of changes or factors? One question.
I didn't actually get that, sorry.
Okay, she says, what are the environmental factors that affect men causing infertility? Then, does women also cause fertility issues in men as part of lifestyle changes or factors?
Yeah. Okay. So environmental factors that affect infertility in men is typically lifestyle things. So, for example, wearing tight boxers. So during the presentation, I spoke about there needing to be a controlled temperature, excuse me, in the testis, right? So wearing tight boxers, it pulls the testis close to the body and increases the temperature in the testis and impairs sperm production. So that can affect fertility in the men. Another thing is lifestyle choices. So I'm talking drinking, excessive smoking, that plays a part in it. Also, diet. What kind of foods are they eating, right? Another thing that also plays a part is medications, right? So there's some hypertensive medication that decreases sperm function, okay? I hope that's answered the environmental factors that can cause infertility in men. Then the other things like disease. So obviously, if they have cancer, have any kind without preserving their sperm, that would cause infertility. If they are diabetic, that also affects fertility, and also childhood mumps affects fertility as well in men. So I'll move on to the first question. Does weight gain cause infertility issues in men as well as part of their lifestyle. So, in terms of weight gain, yes, it does affect, and it's really down to the heat as well. So, as they're getting bigger, their testis is now squished in between the heat. So that also affects sperm production as well. Do you have any other questions?
Yes, I do. From the pre-registered contact has this and to do. Yes, she to conceive.
So endometriosis and ovarian cysts, right?
Yes.
Okay. So with both endometriosis and ovarian cysts, you need to have um, a detailed evaluation of how severe the case of endometriosis is, and in terms of the cysts, where how big they are, and if they need to be drained or not, if they resolve after your period or not, are they reoccurring or not? So all of this, um, there isn't a straightforward answer without assessment. That's really what I'm trying to say. Because the severity of either of them, yes, it can definitely affect, right? But we need to assess it and know how to proceed with treatment. But is it impossible to then get not? Is it like you say, okay, it's impossible to get pregnant if you have endometriosis or cysts? Not true. So as long as you get intervention in time and we're able to assess and know, okay, this is what you need, then we're able to increase chances of successful conception.
Thank you. Thank you. Madam, if you're listening, I answered your question. And then there's another question from the pre-registered. It says, what triggers infertility? How can it be reversed?
Okay, so what triggers it? Like I stated, it can be multifactorial, right? It can be, if I want to say it in broad terms, it can be grouped under egg quality, sperm quality, uterine factors, and tubal factors. If I'm going to be, kind of wide with the answer and broad with the answer, because it can be any or some of the factors. In terms of treatment, it depends on what's going on. So the intervention can be surgical. So, for example, if there are fibroids in the uterus, if there are adhesions, we can try and, remove the adhesions, remove whatever polyps, and remove the fibroid, right? And hope that that then helps with the secondary infertility. If it is strictly, if it's a varicocele, we can treat the varicocele in the man and wait a couple of months and see if the sperm parameters improve. So that would be also a surgical intervention. Then it can be assisted reproduction. So, for example, in cases of a blocked tube. So, if you have bilateral blockage, so that when I say that, I mean blockage in both fallopian tubes, right? Then we can treat that with IVF. So, we bypass the tubes and we go directly to the ovary, collect the ovaries, collect the eggs from the ovary, and then fertilize it in the lab and transfer it back into the uterus. So, and then it could also just be lifestyle changes. You can lose weight, try and keep your stress levels down, stop drinking, stop smoking. These are so it just depends on your assessment that will say, okay, this is what we're going to do for as a treatment strategy.
Okay. There's another one. Sorry, I hope we're not taking so much of the time. Um, Another one from the
No, no.
pre-registered guest says, yes, I've been trying to conceive for the past years. She didn't say how many years or how old she
Okay.
is. I had PCOS after visiting a gynecologist. So I'm guessing she was diagnosed with PCOS after she. I guess she's
Okay.
asking how she can conceive and with PCOS.
Okay. So if you've got the diagnosis of PCOS, right, it's important to then know, are you having regular periods? What is the severity of the PCOS? Is it affecting your ovulation? If it's affecting your ovulation and everything else is fine, it's likely that your doctor can just go ahead and do an ovulation induction, and then you can attempt to do timed intercourse at home or pair it with an IUI, that's an intrauterine insemination in the clinic. So how to proceed again is a personalized thing. There's really no one size fits all in fertility. It is individualized based on your circumstances and your test. So it would be important to, after we receive your diagnosis, the next question should be, what are the next steps? What can we do to either get me ovulating if I'm not ovulating? If there's male factor, what is the level of the male factor? Would it be an IUI, or should we just go ahead for an IVF? All of this will need to be discussed with your healthcare provider.
Thank you, Dima. I think we have two more questions to say. This one, she sent in from Calabar. I won't mention the names, but there are a lot of people. Okay, the last question you just took was from Nasarawa State. The other
Wow.
one was from Bielsa. Somebody from someone with endometriosis. This one's from Calabar. Can someone with endometriosis still conceive?
Yes. Yes. Again, it depends on the severity, the locations of the endometriomas, right? And that's why assessment is important. What are the effects? What is the level of penetration of these endometriomas, their locations, and can they be removed? Will removal increase chances of getting pregnant, right? But it's one of those things where, is it possible? Yes. But you need to get assessed properly and then have a clear plan to get you to your goal, which is obviously a live birth of a baby.
Okay. Okay. So one more question. I'll still check the chat box after this one. This one is from Mowe, Ogun State, all the way. She said, "What is the cause of infertility? All the tests carried out are okay." That's like
Okay. So
unexplained
in cases
infertility.
like that, yes, exactly. That's what we would term unexplained infertility. So in cases like that, so are you asking for the cause?
Yes. More like,
Okay. In cases like that, that means that when we term a diagnosis unexplained, it means that we have reached the the capacity or the level to which science can take us to find a reason. So there's always a reason, right? But it's just that the tests are not sophisticated enough at that point to find out what is going on, right? So in unexplained infertility, sometimes it can be genetic, right? So they can be one or both partners might have a genetic mutation that is affecting. It can be mechanical, so it can be a situation where either intercourse is not appropriate, is not happening often enough. You don't actually know when your ovulation is, so you're not timing ovulation properly, and you're not, you know, having regular intercourse at the right time in your cycle, right? So these all of this can be the cause of unexplained infertility. But again, now that you've gotten assessed, the next thing is a plan. It will be up to you in terms of how quickly you want to reach your goal. That will then determine the kind of plan that you'll be placed on. So you could go ahead and do an ovulation induction. So you know you're definitely ovulating. That is not an issue. Then you go ahead and have timed intercourse around that, induced ovulation and see if there's success. Alternatively, you can go ahead and do an IUI where we know that ovulation has happened and we also know that sperm has reached the fallopian tube. Another option could be We do an IVF cycle, we take the egg, we take the sperm, we can see with our eyes that fertilization has occurred, and we just transfer that embryo back into the uterus and hope for implantation. So in unexplained infertility, the treatment options are a lot wider than in, cases where, we have specific causes, right? Does that make sense? I hope it does.
Yeah.
Yeah.
Yes, yes, it does. Okay. So that's all the questions that
I can see one
day, and I'm
question
really
here.
glad a lot of people interacted.
Sorry, Aruna, I can see one question here. In primary infertility, how many years after trying is one considered TTC? And before what age is it considered best to seek help in a fertility establishment? This is a really, really good question. Um, so, how many years? So, the typical kind of standard definition is 1 year. If you've been trying having adequate intercourse over the course of 1 year and you know you're ovulating and it's not happening, a year, if you're under the age of 35 as the woman, right? And your spouse is also under the age of 40, right? So we know that it's unlikely to be egg or sperm factors, quality factors. So you wait a year, you can try a year and then present at a clinic. If you're above 35, your partner is above 40, 6 months is about, you know, the defined time to try and conceive at home before presenting at a clinic. But all of this is if we know that everything is okay, right? But if you have those risk factors that I mentioned during the presentation, so if you've got absent or painful periods, if there's a history of fibroids, if there's a history of low sperm count, if there's any kind of pelvic surgery, right, then it's prudent to present at the clinic faster. So for people below 35, I personally would advise after 6 months and you know you have any of these issues, present yourself and just know where you are. Knowledge is power, really. And with knowledge, even if you don't necessarily want to get treatment, at least you have clarity and you're able to plan yourself accordingly and know what you're going to do.
All right. Thank you so much, Dima. Even me, I've learned a lot today. Chijike, do you have any other inputs? We see our presenting their questions. We're going to send individualized in an FAQ format. FAQ is free as questions. We always do that after every webinar. So we see the questions and the answers there. So in case anything you have in mind relates to what we talked about, you can have the question answered. So thank you so much.
Thank you very much, Ujoke, for having us.
Can you
This
tell
is
us a
amazing.
little about yourself again before?
Sorry, I didn't hear the last thing you just said.
No, no, no. I said, can you tell a little more about yourself and where we can find you and your clinic in case anybody is in
Okay, right.
Abuja and they want to
Like I
provide?
said earlier, yes, yes. So like I said earlier, my name is Dema. Dema Sekibo. I'm a clinical embryologist and the practice director at Orchid Fertility Clinic. We are located at 29 Mambila Street off Aso Drive here in Abuja. On the screen, you can see our hotline and my personal work email. So even if maybe you felt shy to ask any questions, or send in your question on the chat box, please feel free to reach out either via that number or via the email that I've put on the screen. Feel free to check out our website. You could also book an appointment on directly on the website. We offer virtual appointments and in-person appointments as well. Thank you.
Okay, thank you so much for the opportunity.
Oh, thank you. I should be the one appreciating. Thank you so much. This means a lot to me. It means a lot to me. Thank you very much. I have a question of my own. No, I
Oh
can
yeah,
ask.
please. Yeah, go on.
So I wouldn't really say it's much of my own question, but I've noticed something. Considering the fact that the TTC moms, women, particularly women who are trying to conceive, they are like the most vulnerable market in the world, the most vulnerable, the most delicate, the most at risk market. Now, everybody has something to sell to them. Everybody has something to advise them to do. Everybody has, one thing or the other to offer them. And, you go to even churches, like when they want to pray for um, couples that are, looking for the fruit of the womb, it's actually the women that they are usually hammering on. It's usually the women, barrenness, whatever. Um so so now a lot of women are pushed to the extreme, which is where my question is going. You see a lot of them taking all sorts of concoctions and potions. This one person will mix something and they will drink. Another person will say, oh, if you want children, eat salt, all sorts of things. So how do we go about dispelling these myths, especially this herbal medications? What are your thoughts on exploring options? What are your thoughts considering safety and every other thing in between?
Okay, so thank you very much for your question. Um, I agree, it's an extremely vulnerable community. Um, in terms of safety, I think that's what we're doing here today. And that's what we need to keep doing, which is raising awareness, and not just any kind of awareness, awareness with evidence based, backed information, right? Because the reason why anyone will go and take anything is because of desperation. Now, personally, I've been there, so I can speak from personal experience. I went through secondary infertility, so this particular presentation is something that is close to my heart. I had my daughter, my first child, 5 years ago, and it took me 5 years of trying, of waiting, to have a second child. And there is, it can be a very, very trying period. People asking you, what are you doing? Are you doing brother and sister with your husband in the house? You don't know that you're here to give birth to children. Comments like that, and it can be very difficult to then say no to something that someone says that, look, if you take this thing, it will work, right? But as much as we want to get to our goal, it is very important that we don't take anything that will be caustic to the system, right? Some of these herbs, they are not tested, how they make them in unsanitary situations. You're saying drink. I know of some herbs that they ask the ladies to put inside themselves that can, cause some serious damage to your anatomy, can close up your cervix, can destroy the environment in the vagina, and just generally do more harm than good, right? So my advice, or well, I'm a proponent of awareness, raising awareness. Know your choices. Be informed about the type of help that you can get. What is the limit of the science? And right, and try and go to that limit. Once you reach the limit, it can be very difficult, right? But what I feel that no one should resort to is taking things that are not NAFDAC registered, have no evidence, because typically they do more harm than good.
Wow, thank you very much. Thank you very, very much. I really do appreciate this. I really do appreciate.
Thank you
So
for having
we'll
us.
be yes, we will be drawing the curtains shortly. So for
Sure.
everyone who joined in, thank you for joining. We hope to do this again and again. There's still a lot of topics to go. There's still a lot of topics to discuss. Hopefully we will, we'll host another one and then we'll let you know. There's a form Um, Ma'am Eromina, please can you share the form again, the registration form of this event, so that those who didn't fill it can actually do. We can
Okay.
post it on the comment section.
Post it on
So
the
go ahead and
chat.
fill the
Okay.
form. We will look at it. Yes, on that. So any further thing that we see, maybe any question, because this topic came through, we had to vote in the WhatsApp group, and then we had to come up with this one, and then there are other topics as well. So anyone that you want us to attack next, you can put it up, and then we'll find a way to ensure that it happens. Thank you all so much once again. um like she said, the number is on the screen, and for those who are in Abuja, you can easily locate the clinic. You can easily locate the clinic. It's central, so it's very easy to locate. You can put a call through, visit. It's very important to get information from the right people. you I've seen people who have been exploited. I have a community of over over 3,000, what is it called, over 3,000 women, yeah, women and mothers, Healthy Wealthy Moms Club. And I've heard stories, I've heard heartbreaking stories. People have gone to all sorts of places. They've taken all sorts of things. Some of them have been poisoned in the process, just because they're looking for fruit of the womb, right? And it's understandable. It's You would never understand this until it's you. You will never. Just like I was discussing with somebody recently, and I was talking about chronic pain, and it's so the way people living with chronic pain are treated in healthcare circles, not just in Nigeria but around the world. I'm not surprised. It's until you have your own of the cake, you will never understand the taste.
Yeah.
Till you have your own share and bite into it, you probably never understand the taste, and it's difficult to manufacture empathy. Very difficult. So the fact that there's somebody around who has the knowledge, and not just the knowledge, the experience not only by clinical work, but by personal experience, because that's another interesting thing. For example, you're able to stand in as a professional but also as a counselor. You're able to look at the woman and say, I've been through this, done that, seen that. I can understand a bit of how you feel, contrary to
Yes.
what a lot of other people would say. Yeah. So a lot of people will feel happier, a lot of women will feel happier opening up to you and all of that. And interestingly, again, just like you presented, I once saw a study that was looking at anxiety levels, the role of the antagonistic role of cortisol, and I think is it oxytocin or estrogen. So there's this upregulation and downregulation relationship between them, and it was
Mm-hmm.
basically talking about the fact that when women are stressed and anxious, when women are anxious particularly about conception, it drops
Yeah.
the chances that they will actually conceive.
Yeah.
So a lot of people who are running about with that fear, anxiety, oh, I need to conceive, will this one work, will this be the ultimate, the golden intercourse that will bring the fruit of the child and all of that. So sometimes when they come close to the right professional who has the right information, not people that will peddle fear, not people that will try to convince you just for you to buy one supplement or one medication that will put you at risk, because some of them may even be affiliated to health professionals or be health professionals themselves, and they'll make all sorts of promises that can put the woman, endanger her life. So it's very important to consult. And you do virtual consulting as well, right?
Yes. Yes, we do. We do.
So anybody can reach out. It doesn't have to be you in person. You may have a neighbor, a church member, you may have a colleague, or your spouse, whatever. You can just decide, okay, let's book a call, let's book a consultation, let's go there in person and have some tests done, whatever the case may be. I would really advise that, especially these days that a whole lot is going on in clinic. Let me even talk about this. The regular system, the regular hospital system. You may go to the hospital to complain about something. The next time you are coming back, it's 3 weeks or 3 months. Your next appointment, come and see the guy. The guy is not available. By the time you are meant to come, they're already on strike. You know. So to be honest, I'm just saying this. So, um, it's very important that when you see opportunities like this, just grab it. When you see opportunities like this, I'm grateful that you didn't even you didn't charge me for this. I know how much I would have paid to host you. It's not easy. See bio now. It's not easy. So I know how much I would have paid, but sometimes people see opportunities like this and they don't really appreciate it. What I do personally is when I see something like this, I'll grab it with my two hands and add my legs. Like I'll ensure that I get the number of the instructor, the facilitator, and I just show appreciation. Even if it's not like bottle of wine or cow, I'll type long appreciation message, you know, and have their contact, establish the relationship. And then whenever I can be walking on the road and somebody will meet me and they are like, oh, please, do you know any fertility expert? I'll just go to my phone and I'll type, go to my WhatsApp, I'll find the number and I'll send to them. Just like now, an organization was asking me for a psychotherapist and which other thing again, psychotherapist and one other professional. I'm like, yeah, sure, with all pleasure. I can easily recommend because I have those people in my network and I have a good relationship with them. So this is what I'm begging us. I'm pleading with us to do. Please ensure that you are keeping in touch and then you are meeting the right professionals for your care. Thank you
Yes.
once again,
Thank you very much
and
again.
thank you very much. Thank you very much. Yeah. So let me quickly feedback where there's something like that. I can't remember what. So this is the form. So I sent it. So you can click on it and and fill it if you are yet to. Yeah. Is there a feedback form or should we use the same? Okay. We're meant to have a feedback form. So for everyone who joined either through YouTube or whatever platform, YouTube and LinkedIn. So for those who joined via YouTube, um, please ensure that you are in Healthy Wealthy Moms Club. So I'll send it so that whatever is happening will also share it there. Let me quickly send the link
So I have
here.
updated that
Then I'll
form
end
link.
the call. So anything that is happening.
There's a part where they include their feedbacks. So now, did you attend? It's not, are you going to attend? So for everybody who is clicking now, it's assumed that you attended the webinar. Your feedbacks on the form now. Coach CJ, did you get that? I said the link I posted now. If they click the form, there's a question, the webinar, and what are your feedbacks on the webinar? So they can
Please
drop their
hold on.
feedbacks on the form now.
No, don't come in.
Okay, that's fine. That's fine. So like I was saying, this is a collaboration a collaborative project between Healthy Wealthy Moms Club and Orchid Fertility Clinic. Okay. Healthy Wealthy Moms Club is a confluence of health and wellness and wealth creation for women, particularly mothers, women across every age group, particularly women of childbearing age, married women, moms, uh, women postpartum, pregnant women, women who are trying to conceive, women of women, mothers of children with special living with special needs, and postmenopausal group as well. I mean, every group is represented. So looking at wealth creation as well. So where wealth meets wellness. That's what Healthy World Moms Club is about. And you cannot really have wealth. I mean, you can't just be wealthy and not be healthy. It's not going to make sense. So that is who we are. We've already introduced you to Orchid Fertility Clinic. So yes, I'm going to post the link to the group chat. Who joined? You can use this link to join Healthy Wealthy Moms Club, and then any other thing we'll communicate it with you there. Any link, any updates, you will still be, you get the information from there. So thank you, everyone. I will be turning off the live session now. I'll end the stream.
Thank you.
You're welcome.